Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss Ayurvedic herbal treatment of a rare form of disease known as PAH. The full form is Pulmonary Arterial Hypertension, in short also known as pulmonary hypertension. Now this is, as I said, quite rare, but it can be quite serious and quite fatal in the long run. What happens in this disease is that the pulmonary arteries which supply blood to the lungs, these constrict and blood flowing through them goes much more slowly. So there is a sort of backlog of the circulation, and gradually this results in right-sided heart failure. So the long-term symptoms are of swelling in the body, breathlessness, cough, weakness, and so on. Now this mostly is a primary or idiopathic type in which no known cause is there. But it can also run in families, and it can also be secondary to other causes. It can be secondary to left-sided heart failure, or there can be blood clots in the body, or some sort of autoimmune disorder, or overall inflammation in the body can also cause this. So the treatment needs to be given as per the known cause of the disease, and it is always advisable to start treatment as early as possible, because if the treatment is delayed, then the constriction which is there in the arteries, that can slowly cause fibrosis and cause irreversible changes in the pulmonary arteries. It is very difficult to treat the disease at this stage, but if treatment is started quite early, usually we see quite young patients having this sort of disease because it runs in families. So it is quite sad to see that young people are affected with the disease, and their whole life is affected and their life is cut short. So Ayurvedic herbal treatment needs to be given very aggressively, and we give Ayurvedic herbal medicines so as to reduce the constriction of the pulmonary arteries, and if there is any block in that, we try to give medicines to remove the block so that the blood can flow more easily. In addition, we also give symptomatic treatment to the patient. Whatever the symptoms are there, we try to lessen that. But with most patients, after giving treatment for about 6 to 8 months, almost the symptoms, the severity of the symptoms is considerably reduced, and the patient can lead a near normal life. And after that, we can see the symptoms. If there is a recurrence of symptoms, we can still continue medicines or taper them in small doses, continue them for a long time. That depends on patient to patient basis, how the patient is responding and whether there is recurrence of symptoms. But in most cases, we have seen after treatment for 6 to 8 months, most patients are quite comfortable and they can manage with almost no medicines or just 1 or 2 medicines. The most significant factor is that the seriousness of the disease or the poor prognosis of the disease can be altered significantly, and such patients can live a near normal life, and their quality of life is very good. So friends, this is in short a description of Ayurvedic herbal treatment of PAH, pulmonary arterial hypertension. Let's meet in the next video. Goodbye.